Hello, everybody. Welcome to All About Alzheimer's Livestream. I'm Angelica Olea, the VP of Operations here at Assisted Living Locators. Today's episode, we're exploring the stages of Alzheimer's and how to plan for long-term care. This live stream is to help families understand the progression of Alzheimer's disease and to make proactive care decisions. In today's episode, our goal is to help empower caregivers with the knowledge of Alzheimer's progression and to provide guidance for care planning. I want to encourage viewers that are joining us today to please submit your Q&A, and at the end, we'll be going over that live. We do have people moderating on Facebook, LinkedIn, and YouTube, so please be sure to submit those questions. I'd like to invite my guests that are joining us today to share a little bit of background about themselves and why Alzheimer's is so important to them. And our first guest is Jennifer Eastman. Welcome, Jennifer. If you could please share a little bit about you and why is Alzheimer's so important to you?
Hi, everyone. I'm Jennifer Eastman, the owner and certified senior advisor of Assisted Living Locators of Southeastern Wisconsin. I'm dementia care certified and have been assisting seniors and their families in various roles for over 2 decades. I work closely with families and caregivers of loved ones with dementia, helping to provide resources, guidance, and support. So happy to join you all today.
Thank you. And Ryan Myjok, would you please introduce yourself and share why Alzheimer's is so important to you?
Sure. Thank you for having me. My name is Ryan Myshak, and I am the owner of Assisted Living Locators in Northeast Maryland. I am also dementia care certified. I am a pharmacist of 15 plus years, so I've been navigating the healthcare market for quite some time now. And I do volunteer community education on dementia for the local Alzheimer's Association. So I really enjoy being of service to others and helping guide people during a very overwhelming time because there is a lot to go into that goes with dementia and caregiving and all aspects of it. So thank you for having me.
Yeah, and welcome back. Thank you for joining us again. So we've got a lot that we are unpacking in this episode today. So I would like to just jump right in and we can get started on our first topic, that is understanding the stages of Alzheimer's. So Jennifer, are you able to talk to us a little bit about the stages?
Yes, yeah. So today I want to share with you some of the more common signs you may see early on. Alzheimer's is often diagnosed in this mild dementia stage. This is when it can become clear to family and doctors that a person is having significant trouble with their memory and thinking. The symptoms are impacting their daily functioning. In this early mild dementia stage, people may experience memory loss of recent events. Individuals may have a hard time remembering newly formed information, and they may ask the same question over and over again, such as, what are we having for dinner? What are we having for dinner? What are we having for dinner? Trouble with problem solving and complex tasks and sound judgments. Forgetting to pay bills or balancing a checkbook may become overwhelming. Missing appointments. Many people experience lapses in judgment, such as when making financial decisions. Changes in personality. People may become subdued or withdrawn, especially in social challenging situations. They may be irritable or angry when it's not so typical for them. Reduced motivation to complete tasks is also very common. And getting lost or misplacing belongings. They may have trouble finding their way around, even in familiar places. Such as, going to the grocery store or getting back home. And it's common to lose things or misplace things, including valuable items. And you may end up finding those items in surprising places, like the car keys in the freezer or things like that.
Thank you so much. Yeah, I know that's something that we hear very often, is the same questions being asked repeatedly, or, like you mentioned, that the keys being lost and you find them in the refrigerator. So these are definitely great points that you pointed out. Thank you, Jennifer. And then we've touched on these in previous episodes, but if you'd like to learn more about the severe and the late stages of Alzheimer's, please, you can look back on our previous episodes that you can find at assistedlivinglocators.com. Our previous live streams really deep dive into these topics. So for now, we're going to cover a few others, but please feel free to refer back to those. And Ryan, what about the planning process of the long-term care?
Sure. Planning in the various stages is definitely very important. I think the more planning you do and more prepared you are, the better off everyone is going to be. In the early stages, I think it's all about having conversations with that person with Alzheimer's or dementia. Understand what their care needs are, what their future wishes might be. Where do they want or wish to receive care? They can be difficult conversations, but they should occur in those early steps while that person can still make their own decisions and voice their concerns in order for you to be able to secure those wishes later on. Talking to an estate attorney is an excellent part of that plan. Setting up wills, trusts, advanced directives, and power of attorney. Someone who can make those medical and financial decisions later down the road if and when someone is no longer capable of making those decisions. It gets much more complicated if this is done in the later stages, moderate to severe, because that person may not be able to sign or authorize that power of attorney. Also, seeing a financial planner to discuss the financial situation, come up with a budget for care and the different types of care and what those costs may be in order to properly allocate funds in the future as someone progresses through the disease and needs more care. Some types of care that are available in the moderate to later stages if needed. In-home care support. There are people that can come to your home and do modifications to make it safer. There are also in-home care companies that can provide a caregiver for a number of hours on any given day to help with activities of daily living, bathing, grooming, dressing, ambulating. Also, they can do activities or just spend time and have companionship with the person, light meal cooking. Home health support is a skilled nurse that can do IV medications, wound care in later stages if needed, if someone has those other comorbidities. And another excellent service is adult daycare programs. These are centers where one can go for 8 hours of the day. They can offer transportation, and they do medication management and support of activities of daily living, and also provide a meal with a lot of activities throughout the day. So this is an avenue for someone to be able to go to work or do other things for themselves in a very cost-effective way for their loved one to receive care.
Thank you, Ryan. Yeah, I know a lot of people aren't very familiar with the adult daycare programs that are out there. So thank you so much for bringing up that point, along with, if possible, trying to plan this while your loved one is still in the early stages is so critical. As you know, as it progresses, they might not have that option to make those decisions. So thank you, Ryan. Jennifer, what about the middle and moderate stages? Are you able to touch on that for us?
Yeah, in the moderate and middle stage of the Alzheimer's journey, the needs can become much more structured and hands-on. Focus on providing significant assistance with the ADLs, which are the activities of daily living, such as bathing, personal hygiene, grooming, toileting, eating, dressing, moving and transferring, helping with the assistance of maybe, getting up from the chair, things like that, and medication management if you're not already doing those things, while you're still continuing to encourage them to be as independent as possible. Often requiring frequent reminders and structured routines, such as maybe creating a poster board of a calendar with the activities of the day. Managing potential behavior changes, and ensuring safety through environmental modifications and supervision. Maybe putting alarms or sensors on the doors, or securing the basement stairs. And you may need to start to consider additional support coming in home, such as caregivers or looking at other options, and especially if they're living on their own, of having them move into an assisted living or a memory care community. But lastly, I really want us to remember how important that social and emotional connection is for both our loved one with Alzheimer's and also for you as a caregiver as well.
Absolutely. And that socialization, that's what keeps us alive. That's what keeps us young. So that is such a critical part of this. Something that I heard recently that I thought was really interesting was people were using their Alexas to set reminders. And that was really helpful, in that beginning stage where really you don't need that full-time assistance or caregiver, that assisted living. So lots of cool technology that is coming out that we can utilize in this as well to help us. Thank you, Jennifer. Ryan, what about full-time support and the advanced care options?
Yeah, I think Jen alluded to one of them, and that would be memory care. So this is a specialized care. It's usually an area within an assisted living community or a standalone facility where there are trained staff that are very focused on activities and support for those with dementia. So it's a safe and secure environment. Sometimes people develop behaviors related to their dementia or become a risk of wandering. But they provide increased supervision, personalized programs, and specific activities different from those in assisted living that focus on cognitive stimulation and also just keeping people engaged and keeping them busy throughout the day. Some other services that may be needed in the later stages. One is hospice. Hospice care is something that focuses on quality of life for people who are experiencing an advanced terminal illness and for their caregivers. The main goal of hospice is to provide comfort for people in the later stages of a terminal disease. And it involves an entire team of medical professionals providing comfort and symptom relief, pain management in the home, in a community, or even in the hospital. And it also, for the caregivers and family, it offers grief counseling and medical equipment, medical supplies, and it can also be used as a respite care option to give the caregiver a much needed break. Hospice is typically provided during the last 6 months of someone's life. There are people that go on and off hospice services at times, and it's typically covered by Medicare, Medicaid, and other private insurance. So definitely check with your insurance provider before initiating hospice services. Palliative care sometimes is very similar, but sometimes confused, but it's different than hospice services. And this is specialized medical care focusing on pain relief and management of side effects from medical treatments. The main difference between this and hospice is that the patient may continue to receive treatment for all chronic medical conditions, whereas in hospice, they're likely to discontinue medications and treatments for other chronic illnesses like high blood pressure, high cholesterol, diabetes, those sort of things, and only receive care and treatment for the diagnosis for which they are receiving hospice services. Palliative care, on the other hand, it still focuses on quality of life for both the family and the caregiver. And the palliative care team will work alongside the patient's regular medical team, not in substitute of, to provide an extra layer of support for both the patient and the family. And it is also not dependent on whether a person has a terminal illness or an illness that can be cured. And it can still be covered by Medicare, Medicaid, and other private insurance. If you have other questions, there's a lot of information on these slides. Feel free to go back and watch or rewatch to be able to gather more information about both hospice and palliative care. Thank you.
Thank you, Ryan. Yeah, I know on that. And I like how you said typically hospice is for the last 6 months of life, because we do see that once they get that additional care, they may get off hospice. And so it can actually help with the caregivers providing that extra support. So thank you so much for bringing that up. And yes, if you have any additional questions, you can always reach out to an assisted living locators advisor like Ryan and Jennifer in your area. So our next topic I'd like to discuss is financial and legal planning for long-term care. For our viewers that have not seen our previous live streams, we have touched on financial planning, and some of the highlights in those episodes are long-term care insurance, saving strategies, government assistance programs that can help cover Alzheimer's related expenses. We've also reviewed legal considerations. So if you want some advice or direction on setting up power of attorney, advanced directives, ensuring guardianship, decision making as the disease progresses. Any of these topics are of interest to you, please go back and check out our live stream episodes that can be found at assistedlivinglocators.com or our YouTube channel. So please go back and check those out. If you have any additional questions, they're great resources for you, or reach out to your local senior living advisor. Our next topic that we're going to be diving into is preparing for challenging roles and responsibilities as a caregiver. So, I want to remind all of our viewers that are joining us today, please be sure to submit any questions that you have on YouTube, Facebook, or LinkedIn. We are moderating those, and we'll be going over our live Q&A here at the end. But let's dive right into this. So, Jennifer, what about transitioning roles and for caregivers?
Yeah, as your loved one's care needs change, it can bring about a lot of emotional and practical shifts. It's perfectly normal to feel a mix of things as you adjust to new dynamics in your relationship, whether you're a spouse or a child stepping into a caregiving role. It can feel very overwhelming. This isn't something we're prepared for. You may be taking on more household roles, as well as such as the finances and overseeing the whole medical care. And that in itself can often feel like a part-time job. Communication is key during this transition. It's important to talk openly with your loved one about the changes ahead, even though they may not fully understand what's happening. Set realistic expectations for both yourself and for them, and be flexible when things change unexpectedly. Over time, caregivers may find themselves balancing caregiving with other responsibilities such as work or family, which can be emotionally and physically exhausting. Self-care is essential for caregivers to avoid burnout. And it's important to be patient with yourself and with your loved one, because these transitions are very difficult. And you might need more time to adjust to those new demands. And I encourage you to reach out for help sooner than later, and not wait until your caregiving cup is empty, but to gather that support team around you, and just start, creating those plans for the future.
Absolutely. That's so important. If you're a child and all of a sudden, you're having to take care of your parent, that can be so stressful on you. And so it's so important that, if you need a break, everybody needs that break sometimes. We've got to balance, that. And so reach out for respite care, adult daycare. There's so many options to help with this. You're never alone in this journey. So please be sure, if you need assistance, you can reach out to the Alzheimer's Association or a local advisor. Thank you so much, Jennifer. That's such an important topic that you just covered right there. Ryan, additional caregiving support?
Yes, there's a number of things that a caregiver can look into and gain support within their local community and even online. So, and Helga, you mentioned one, the local Alzheimer's Association. Not only do they have a national hotline that people can use, if they have a question at 3 a.m. because they're experiencing something new and don't know what to do, they can call. The Alzheimer's Association also has local support groups. There's groups that meet locally, maybe at a restaurant once a month for lunch. They bring their loved ones, and they get to just talk to one another and about their experiences. And a lot of them get really tight and bond quite a bit. And it's a wonderful outlet for caregivers. You may also find them at local senior living communities, whether it's a retirement community, a memory care, assisted living. And you can find them online. There's a lot of dementia support groups on Facebook, other social media platforms where people just ask questions and give each other feedback and support. Another thing is respite care. So, Jennifer mentioned the caregiver burnout. The caregiver burden is definitely a real thing. I just had someone who's been caring for her mom for 5 years and just needed some time away to take a week or two vacation. And so assisted living or memory care communities can offer respite stays, short-term stays, so the caregiver can take care of themselves or something they need to do while their loved one is safe and receiving the care that they need. You can also get more in-home care support as needed too if you need to go do things as well. So there's a lot of support out there that can be tapped into.
Absolutely. Thank you, Ryan. Yeah, it's so important to care for yourself in order to care for others. The burnout that we see is absolutely real, and the guilt that may come along with that. So thank you, Ryan. So let's jump into our Q&A here. I see that we've got some questions that have come in, so I'd like to invite Jennifer back. Let's see. So first question for you, Jennifer, is, let's see, Janice from Phoenix says, when should you start looking for memory care options? Great question.
Yeah, great question. I believe it's always a good idea to begin your search sooner than later. No two individuals experience Alzheimer's in the same way. And unfortunately, there's no way to predict. There's no crystal ball to predict what type of care is going to be needed, in the coming months or farther out. Each situation is unique. For instance, some individuals may hit that critical point sooner. They may live on their own in their house or condo or independent senior living apartment. Or, we may hit a critical point with incontinence, which becomes a major concern for the caregiver, or might become difficult because of your own health situations that are going on. Or if your loved one starts to confuse day and night, the caregiver can become exhausted really fast, trying to find time for them to get that much important rest in themselves. These are all valid reasons to start looking for memory care options. And I want to caution you against waiting and delaying that search, because there can be barriers in place for finding and being able to move into your preferred memory care community. Memory care communities typically want to work with and move folks into their community that are more in the middle, moderate stages of Alzheimer's, when they're still able to maybe walk independently, more minimal assistance, be able to communicate and interact with the staff and participate with the community activities.
Thank you, Jennifer. And I'm sure that makes it easier on the staff as well when they get to know the new resident in those middle, early, or moderate stages before it gets so severe where they are bedbound or in a wheelchair. Ryan, anything that you want to add on to that?
Really, I definitely agree with what you just said. It's working with a few people that have tried to do that in the later stages where they're unable to communicate. They either have aphasia or are completely nonverbal. It makes it a lot more difficult for those caregivers to get to know them, and doing it a little early on when there's still the ability to communicate, understand their likes, their dislikes, what frustrates them, what maybe makes them anxious, and also learning how to kind of redirect that frustration and things like that is really why they like you to move in a bit earlier, before it gets to those later stages. It just becomes, it's a much better relationship and experience for everyone, the caregiver as well as the rest.
Thank you so much, Ryan. Yeah, it's such great points that we've talked about today. A few of those highlights is caregiver burnout is real. Please be sure you're taking care of yourselves, and pre-planning is so critical with Alzheimer's and dementia, and the stages where you can reach out to those for support, whether it's a local senior living advisor to help find care options, or the local Alzheimer's Association. So thank you so much, Jennifer and Ryan, for joining me today on All About Alzheimer's live stream. And I'd like if you could tell everybody how to get a hold of you. Jennifer, how can people find you?
Yeah, I'm in the greater southeastern Wisconsin location, and my email is jeastman, EASTMAN, at assistedlivinglocators.com.
Thank you so much, Jennifer. And Ryan, what about you? Where can people find you, and how do they get a hold of you?
Yes, I am in the Northeast Maryland area, and my email is ryanm, that's RYANM, at assistedlivinglocators.com. And thanks for having me today.
Thank you both so much. And we will be sharing their contact information in the comments section on Facebook and LinkedIn, so you can contact them as well. Thank you so much for viewers joining us and those that are watching this. Our next episode is going to be on creating a safe and supportive environment for dementia patients. So please be sure to join us next time. And if you have not already signed up to our newsletter for future sessions, please be sure to sign up so you can know all of our next episodes coming up. Thank you so much. Have a great day.